Hi, my name is Kayla, and today we are doing an ankle assessment on Caitlin. And so the first part of HOPS is really our history. So we're going to start off with activities of daily living. So we'll ask her questions like what is her age and her name, and what is her occupation and or sport. And at her job, does it consist mostly of walking, running, sitting, and also what type of activity she is involved throughout her day, high, medium, or low. How often? So her free time, how active is she? Does she go hiking? Does she go swimming, running, or does she mostly just sit at home and relax? And also, when does her injury hurt the most? Does it hurt more in the morning, afternoon, or at night, or does it stay throughout the day? And this will also go into her primary complaint. So I would ask her if she could point to the exact spot of injury or of pain, and if the level of pain stays the same throughout the day, or if it hurts more as she uses it more. And also if it hurts more before, during, or after activity. And I also ask her to rate her pain on a scale of 1 to 10, 1 being the least painful and 10 being most painful. And if it has gotten worse or better throughout since the injury has occurred due to her activity. Her mechanism of injury, so I asked if she was hit by an object, and if she was she standing or was she in the air, so was her ankle fixed on the ground, or was it an open range of motion? Was she in the middle of an extraneous activity, or did the injury occur more over time? And if she's recently changed her intensity or technique, then if that made her more prone to being injured, and what position she was at the time of being hit or at the time of injury. This will also go into her symptoms and characteristics. So I would ask her to describe the pain, if it's dull, aching, sharp, throbbing, or if it radiates throughout the limb. And I'd also ask at the time of injury if she lost any sort of feeling or if it was just a very sharp pain at the time. And also if the surface is tender to touch or if she can bear any or no weight on it. And then I would go into limitations, so I'd ask how much she can dorsey and plantar flex foot, if she can invert and evert, and also how much she can bear weight on it, if it has prevented her from functioning normally throughout her day. And then I would finally ask about her past history, so if she's had any previous injuries, any surgery on her ankle, or any ankle sprains or broken ankles, and if there also has been a change in appearance since the time of injury, so if there has been a change in color or any swelling. So the next part of the HOPS assessment is observation. So we start by having her stand and then look from the anterior view. And here we would observe the alignment of the toes and the position of the foot relative to the lamb to see if there's extreme valgus or varus force on the legs. And we'd have her turn. And then we look at the lateral view of the ankle. And we'd inspect for ankle swelling or prominence of the posterior calcaneus, so if the heel sticks out more than normal. And we'd also look to see if there's any swelling around the lateral malleolus. Turn. and then we look at the medial view, and we'd inspect for the high arch and longitudinal arch, or flat foot, or if there's any excessive prominence of the medial malleolus, and observe for any other swelling, and the same with the calcaneal swelling. And then we look posteriorly. We look at the Achilles tendon for symmetry, and we would also again look for valgus and varus forces on the legs. And we would assess the alignment, which should be neutral and normally could be slightly valgus. So then we'd have her stand on her toes, and the heels should move into varus, so they should point inwards, which they do, so you're good. And then we would have her walk to assess gait. And we'd see if she had equal stride length and if the foot position and weight distribution was even. And the foot should be with 0 to 20 degrees of external rotation when walking.
Go.
So now we would look at the anterior view of the ankle while she's sitting. And here we would look at the toenails and the alignment of the toes. And here is when we would look between the toes, see if there's any fungus or any blisters occurring. Or we would also look at the toes for any bunions, hammer toes, or claw toes to see if they are misshapen. And then we also observe her ability to spread her toes, and we would look for more fungus and ulcers. And then we would have her extend her foot, her leg. And then we'd look at the plantar surface of her foot, and here we would also look for warts, calluses, and ulcerations. And we would also look to see if there's any swelling around the metatarsals.
Go.
So the next part of the HOPS assessment is palpation. And we would start with the medial and lateral malleolus. So above, or posterior and inferior to the medial, we would palpate for the tibial nerve. and see if there was any sharp pain while pressure was applied. And then on the lateral malleolus, we would observe the calcaneofibular and talofibular ligaments down her foot, as well as the plantar fascia. And then the posterior side, we would squeeze the back of her ankle to observe the Achilles tendon and see if there's any swelling or pain there. And we would also observe the peroneal tendons, so we would palpate posterior and inferior to the lateral malleolus, also to see if there's any more swelling or pain. And then finally, we'd look at the metatarsal phalangeal joint, so we'd palpate the top of the foot for tenderness or any other swelling near her toes. We would assess. Okay. So next, we would assess her range of motion. So we'd have her in neutral position with the goniometer, and I would ask her to dorsiflex on her own. So you're neutral, dorsiflex. Oh. The normal range of motion would be about 15 to 20 degrees for this one, and then I would ask her to plantar flex. And this angle should be anywhere from 40 to 50 degrees. And then I would also ask her to invert her ankle, which should range from 25 to 30 degrees, and evert should range from 20 to 25 degrees. Go. So now we would do her muscle testing. So first we would test the posterior tibialis. So I put my hand inside and ask her to invert and would resist to see how much pressure is applied, which is good. And then her anterior tibialis, I would do the same, except I'd ask her to invert and dorsiflex at the same time, which is good. The peroneus longus and brevis, I would have the foot in plantar flexion, and I would resist her everting her foot. And then the extensor hallucis longus and brevis, the ankle would be relaxed in neutral position, and I would resist her attempt to extend the big toe. And then I would also do that for the flexor hallucis, so it'd be neutral, and I'd resist her attempt to flex the big toe. Finally, I'd assess the gastrocnemius, so her ankle would be dorsiflex, and I would resist her plantar flexing her foot, which is good.
Go.
So the final part of the Hops assessment is special tests. So the first one I do is the anterior drawer test, so I would grab her calcaneus and pull up to see if there's any looseness in the tendons. I would then go to the apprehension and varus stress test, or the talar tilt. So I'd also grab her calcaneus and I would invert and evert her foot to see if there's any looseness in the lateral or medial ligaments. And then I would do the MTB instability. So I would have her dorsiflex and I would push down and up on her toes to see if there's any looseness in those as well. And then the interdigital neuroma test, I would go down to the bottom of her foot and I would push through to see if there's any swelling or any pain that could possibly make her jump or react.